Did you know that every single minute, someone over 60 loses their vision permanently? And here's what shocked me as a doctor. Nearly 80% of vision loss in seniors could have been prevented with simple steps that take less than 5 minutes a day. Right now, you might be experiencing cloudy vision, struggling to read labels at the grocery store, or seeing halos around lights at night. You might think it's just normal aging. But what if I told you that millions of seniors are losing their precious eyesight simply because they didn't know the answers to a few critical questions? Today, I'm answering the exact eye health questions seniors ask me most often in my practice. Questions that could mean the difference between seeing your grandchildren's faces clearly for decades to come or not. Hello, I'm Dr. Adam Carter, and welcome to Seniors Life Health, the channel dedicated to helping you live your healthiest, most vibrant years with practical, easy-to-follow medical advice. In today's video, we're doing something special. Over the years, I've had thousands of conversations with seniors about their eye health, and I've noticed the same questions come up again and again. These aren't just casual curiosities. These are the questions that reveal what you're really worried about, what's happening to your vision right now, and what you desperately want to prevent. So I've compiled the most common, most important eye health questions I hear from seniors, and I'm going to answer each one thoroughly, in plain English, with practical steps you can take today. We'll cover everything from cataracts and glaucoma to those frustrating floaters, from diabetes-related eye problems to the simple daily habits that can protect your vision. Whether you're 60, 70, 80, or beyond, this information is crucial for you. And here's my promise. By the end of this video, you'll know exactly what to watch for, what questions to ask your eye doctor, and what simple actions can protect your eyesight for years to come. So let's get started with the question I hear more than any other. Now, here's something most seniors don't realize. By age 80, more than half of all Americans either have a cataract or have had cataract surgery. So if you're experiencing this, you're definitely not alone. Let me explain what's actually happening in your eye. Inside your eye, you have a natural lens. Think of it like the lens on a camera. When you're young, this lens is crystal clear. But as we age, proteins in the lens start to clump together, creating cloudy areas. It's like looking through a foggy window that gradually gets foggier over time. Here are the telltale signs. Your vision seems cloudy, blurry, or dim, like you're looking through a dirty windshield. Colors appear faded or yellowed. That bright blue sky doesn't look as vibrant anymore. You're having trouble driving at night because of glare from headlights. You see halos around lights, especially at night. You need brighter light for reading than you used to. You're changing your glasses prescription more frequently. Let me share a story. I had a patient named Margaret, 73 years old, who came to see me because she'd stopped doing her crossword puzzles. She said, "Dr. Carter, I just thought my brain was getting foggy." But when we examined her eyes, she had significant cataracts in both eyes. After her cataract surgery, she called me crying, happy tears, because she said, "I didn't realize how much color I'd been missing. My garden looks completely different." Here's the truth. Cataracts themselves aren't an emergency. They develop slowly, usually over years, but you should see an eye doctor if your vision changes are affecting your daily activities, reading, driving, cooking, if you're having trouble seeing street signs or recognizing faces, if glare is making it dangerous for you to drive, if you're struggling with activities you love. In the early stages, update your eyeglasses prescription. Use brighter lighting when reading. Wear anti-glare sunglasses outdoors. Use a magnifying glass for small print. But understand this, cataracts don't go away on their own, and no eye drops or vitamins can reverse them. The only proven treatment is surgery, and modern cataract surgery is one of the safest, most successful procedures we have. It's usually done as an outpatient procedure, takes about 15 minutes, and most people see dramatically better within days. The key takeaway? Don't suffer in silence. If your vision is affecting your quality of life, it's time to talk to your eye doctor about cataract surgery. The technology has come so far. Many of my patients tell me it's life-changing. Now, cataracts develop slowly and you can plan for them. But our next question is about something much more sneaky, something that can steal your vision without you even noticing. This question keeps many seniors up at night, and for good reason. Glaucoma is one of the leading causes of irreversible blindness in people over 60. And here's the scary part. Most people with glaucoma don't know they have it until significant damage has already occurred. Let me explain what glaucoma actually is, because understanding it is the first step to protecting yourself. Your eye constantly produces a clear fluid called aqueous humor. This fluid flows through your eye and drains out through tiny channels. Think of it like a sink with a faucet and a drain. When that drainage system gets clogged or doesn't work properly, fluid builds up, and pressure increases inside your eye. This pressure damages the optic nerve, the cable that connects your eye to your brain. Most people with the common type of glaucoma, called open-angle glaucoma, have no symptoms at all in the early stages. No pain, no redness, no obvious vision changes. The vision loss starts at the edges of your visual field, your peripheral vision, and you might not notice it until significant damage has occurred. It's like slowly losing pieces of a puzzle without realizing it. Listen carefully, because this is important. Anyone over 60 has increased risk. African Americans over 40 are 6 to 8 times more likely. People with a family history of glaucoma have a risk that's 4 to 9 times higher. Anyone with diabetes, people who are severely nearsighted, those who've had eye injuries or certain eye surgeries, long-term steroid users. I had a patient named Robert, 68, who came in for a routine eye exam. He felt perfectly fine, saw clearly, had no complaints. But during his exam, we discovered elevated eye pressure and early glaucoma damage. He was shocked. He said, "But Dr. Carter, I can see perfectly." That's exactly the problem. By the time you notice vision loss from glaucoma, you've already lost vision permanently. The only way to detect glaucoma early is through comprehensive eye exams that include eye pressure measurement, but normal pressure doesn't rule out glaucoma. You also need optic nerve examination, visual field testing that checks your peripheral vision, and measurement of corneal thickness. If you're over 60, you should have a comprehensive eye exam every 1 to 2 years, or more often if you're at higher risk. Here's the good news. While we can't reverse damage that's already done, we can usually stop or slow further damage. Treatment typically involves daily eye drops to lower eye pressure, laser treatments, or surgery in some cases. The critical thing is this: if you catch it early and treat it consistently, most people with glaucoma never go blind. If you haven't had a comprehensive eye exam in the past 2 years, schedule one. Not just a vision test at the DMV or a quick check at the drugstore, a full dilated eye exam with an optometrist or ophthalmologist. Don't let fear keep you from getting checked. Early detection is your superpower against glaucoma. Now, while glaucoma quietly affects your peripheral vision, our next topic is about those annoying things you see right in the center of your vision. Before we continue, I want to ask you something. If you're finding this information helpful and you want more practical, senior-friendly health advice delivered in simple terms, please hit that subscribe button for Seniors Life Health. We publish new videos every week covering everything from diabetes management to heart health to exactly the kind of eye health information we're discussing today. And click that bell icon so you don't miss any videos that could help protect your health. Also, give this video a thumbs up if you're learning something valuable. It helps other seniors find this information too. All right, let's talk about those mysterious floaters and flashes. If you've ever seen little specks, strings, or cobweb-like shapes drifting across your vision, especially when you look at something bright like a white wall or blue sky, you're experiencing eye floaters. This is one of the most common eye questions I get from seniors, and most of the time it's completely normal. But sometimes it's a warning sign. Inside your eye, you have a gel-like substance called the vitreous. When you're young, this gel is perfectly clear and firm. But as we age, this gel starts to liquefy and shrink. As it shrinks, tiny fibers within the gel clump together and cast shadows on your retina, the light-sensitive layer at the back of your eye. Those shadows are what you see as floaters. Think of it like this. Imagine you're watching a movie in a theater, and there's something on the projector lens. You'd see its shadow on the screen. That's essentially what's happening in your eye. For most seniors, they're a normal part of aging, especially after age 60. They're annoying, but they're not dangerous. You might notice them more when you're looking at a bright, plain background in bright light conditions reading, or looking at a computer screen. The floaters seem to dart away when you try to look directly at them. That's because they're floating in the gel inside your eye and move with eye movement. But here's when you need to worry, and this is critical. Seek immediate medical attention if you suddenly experience a sudden shower of new floaters, not just one or two, many appearing suddenly. Flashes of light in your vision, like someone's taking photographs or you're seeing lightning. A shadow or curtain moving across your vision. Sudden loss of peripheral vision. Why? Because these can be signs of a retinal tear or detachment, a serious emergency that can lead to permanent vision loss if not treated immediately. Let me tell you about Helen, a 71-year-old patient. She'd had a few floaters for years and wasn't concerned. Then one Saturday morning, she suddenly saw what she described as hundreds of tiny black dots like a swarm of gnats, along with flashes of light. She almost waited until Monday to call. Fortunately, she went to the emergency room instead. She had a retinal tear, and because she got treatment within hours, we were able to prevent a full retinal detachment and save her vision. Several things can cause serious floaters. Retinal tear or detachment, where the retina pulls away from the back of the eye. Bleeding inside the eye, especially common if you have diabetes. Inflammation inside the eye. Eye injury. Risk factors for serious eye problems with floaters include severe nearsightedness, previous cataract surgery, diabetes, previous eye trauma, and family history of retinal detachment. The truth is, most floaters don't require treatment. Your brain often adapts and you notice them less over time. There's no proven medication or eye drop that eliminates them. However, if floaters are significantly interfering with your vision, talk to your eye doctor. In rare cases, there are procedures available. But they carry risks and are usually reserved for severe cases. If you have floaters you've had for a while and they haven't changed, you're probably fine, but mention them at your next eye exam. But if you experience sudden new floaters, flashes, or vision loss, treat it as an emergency. Don't wait. Go to an emergency room or see an eye doctor immediately, even on weekends. Time is vision when it comes to retinal problems. Now, many of you watching this video have diabetes or know someone who does, and that brings us to one of the most important questions I'm asked. This might be the most important section of this entire video if you have diabetes, because here's the reality. Diabetic eye disease is the leading cause of blindness in working-age adults and seniors, but, and this is crucial, it's largely preventable if you take the right steps. When you have diabetes, high blood sugar levels can damage the tiny blood vessels in your retina. These damaged vessels can leak fluid or blood, causing vision problems. In advanced stages, abnormal new blood vessels can grow, leading to serious complications. There are two stages: non-proliferative diabetic retinopathy, the early stage where blood vessels weaken and leak, and proliferative diabetic retinopathy, the advanced stage, where new, abnormal blood vessels grow. In the early stages of diabetic retinopathy, you usually have no symptoms. No pain, no vision changes, nothing to alert you. By the time you notice vision problems, significant damage may have already occurred. I can't tell you how many times I've had patients with diabetes say, "But Dr. Carter, my vision is fine," only to discover during their eye exam that they have early diabetic retinopathy. When symptoms do appear, you might notice blurry or fluctuating vision, dark spots or strings called floaters, difficulty seeing colors, dark or empty areas in your vision, or vision loss. Diabetes doesn't just cause retinopathy. It also increases your risk for diabetic macular edema, which is swelling in the central part of the retina affecting your sharp central vision. You can develop cataracts at a younger age, and your risk for glaucoma doubles if you have diabetes. Let me share a powerful story. I had a patient named Thomas, 66, who'd had type 2 diabetes for 15 years. He was inconsistent with his blood sugar control and hadn't seen an eye doctor in 4 years because everything seemed fine. When he finally came in, he had advanced diabetic retinopathy in both eyes. We were able to treat him and stabilize his vision, but he'd already lost some vision permanently. He told me, "Dr. Carter, if I'd known this was happening, I would have taken my diabetes more seriously." That conversation changed how I talk to all my patients with diabetes. Here's your action plan. Control your blood sugar. This is the single most important thing you can do. Studies show that keeping your A1C below 7% can dramatically reduce your risk of diabetic eye disease. Every percentage point matters. Control your blood pressure. High blood pressure accelerates diabetic eye damage. Aim for less than 140/90 or whatever target your doctor recommends. Get comprehensive eye exams regularly. This isn't optional, it's essential. If you have type 1 diabetes, get annual eye exams starting 5 years after diagnosis. If you have type 2 diabetes, get annual eye exams starting at diagnosis. If you have diabetic retinopathy, get more frequent exams as recommended. These exams must include dilation, drops that widen your pupils so the doctor can see your entire retina. Know the warning signs. Even between exams, if you notice sudden vision changes, call your eye doctor immediately. Manage your cholesterol. High cholesterol can worsen diabetic eye disease. Don't smoke. Smoking accelerates diabetic complications, including eye disease. Treatment options include laser therapy that seals leaking blood vessels or shrinks abnormal ones, injections where medications are injected into the eye to reduce swelling and slow disease progression, and surgery for advanced cases. The key is catching it early. The earlier we detect diabetic eye disease, the better the outcomes. If you have diabetes and haven't had a dilated eye exam in the past year, call your eye doctor Monday morning. I mean it. This could save your vision. If you know someone with diabetes, share this video with them. You might be saving their sight, and remember, your eyes can't speak up until it's too late. You have to be proactive. Now let's talk about something many seniors experience but hesitate to mention. Age-related macular degeneration, or AMD, is the leading cause of severe vision loss in people over 60. It affects more than 10 million Americans, and that number is growing as our population ages. But here's some hope. We now know more about preventing and treating AMD than ever before, and there are specific steps you can take today to protect your central vision. Your macula is the small central part of your retina, responsible for your sharp, detailed central vision. The vision you use for reading, recognizing faces, driving, and seeing fine details. AMD is the deterioration of this macula. There are two types: dry AMD, which is about 90% of cases. The macula thins with age, and small clumps of protein called drusen grow. Vision loss is usually gradual. Wet AMD is about 10% of cases. Abnormal blood vessels grow under the retina and leak blood and fluid, causing rapid vision loss. Though less common, wet AMD is more serious and requires immediate treatment. Early AMD often has no symptoms. As it progresses, you might notice blurred or fuzzy central vision, straight lines appearing wavy or distorted, and this is a key warning sign. Dark or blank spots in your central vision, difficulty reading or recognizing faces, need for brighter light when reading, colors appearing less vibrant. Here's a simple test you can do at home. It's called the Amsler grid test. It's a grid of straight lines with a dot in the center. If you look at the dot and the straight lines appear wavy, bent or broken, or if you notice blank spots, this could be a sign of AMD. You should see your eye doctor immediately. I remember a patient named Dorothy, 74, who loved quilting. She came to see me because she said, "Dr. Carter, the lines on my fabric look wavy and I can't thread my needle anymore." She thought she just needed new glasses, but she had wet AMD in her left eye. We started treatment immediately, and while some damage was permanent, we prevented further vision loss. Age increases your risk dramatically after 60. Family history means you're much more likely to develop AMD if a parent or sibling has it. Smoking means you're 2 to 3 times more likely to develop AMD. It's more common in Caucasians. Obesity doubles your risk. Heart disease increases risk. High blood pressure damages the blood vessels supplying your macula. While you can't control your age or genetics, you can control many risk factors. Don't smoke, or quit if you do. This is the single most important modifiable risk factor. Smoking damages the blood vessels in your eyes and doubles your risk of AMD. Eat a diet rich in leafy greens and fish. Studies show that eating leafy green vegetables like spinach, kale, collard greens, and fatty fish like salmon, tuna, sardines can reduce your risk of AMD. These foods contain lutein, zeaxanthin, and omega-3 fatty acids that protect your macula. Maintain a healthy weight and exercise. Regular physical activity and maintaining a healthy weight can reduce your risk. Control your blood pressure and cholesterol. These protect the blood vessels in your eyes. Wear sunglasses. Protect your eyes from UV light. Look for sunglasses that block 99 to 100% of UVA and UVB rays. Consider AREDS2 supplements. If you have intermediate AMD or advanced AMD in one eye, specific vitamin and mineral supplements called AREDS2 can slow progression. These contain vitamin C, vitamin E, lutein, zeaxanthin, zinc, and copper. Important: talk to your doctor before starting these supplements, especially if you smoke. For dry AMD, there's no cure, but the progression can be slowed with lifestyle changes and AREDS2 supplements in certain cases. For wet AMD, treatments include anti-VEGF injections, which are medications injected into the eye to stop abnormal blood vessel growth, laser therapy in some cases, and photodynamic therapy, which uses light-activated drugs to destroy abnormal blood vessels. The key with wet AMD is catching it early and treating it quickly to prevent permanent vision loss. If you're over 60, ask your eye doctor to check for signs of AMD at every exam. Test your vision regularly with an Amsler grid. You can find printable versions online or get one from your eye doctor. If you notice any sudden changes in your central vision or straight lines appearing wavy, see an eye doctor immediately, that same day if possible. Adopt the preventive lifestyle habits I mentioned, especially if AMD runs in your family. Remember, AMD usually affects central vision, not peripheral vision. You won't go completely blind from AMD alone, but it can severely impact your quality of life by affecting reading, driving, and recognizing faces. Now let's move to some of the practical everyday questions I get about protecting your eyes. This is one of my favorite questions because the answer empowers you. While we can't stop aging, we can absolutely protect our eyes with simple daily habits that take just minutes but can preserve your vision for decades. Your eyes need specific nutrients to stay healthy. Leafy greens like spinach, kale, collard greens are rich in lutein and zeaxanthin, antioxidants that protect against AMD and cataracts. Aim for 2 to 3 servings per week. Fatty fish like salmon, sardines, mackerel contain omega-3 fatty acids that support retinal health and may help prevent dry eyes. Aim for 2 servings per week. Eggs. The yolk contains lutein, zeaxanthin, zinc, and vitamin A. Citrus fruits and berries. Vitamin C protects against cataracts. Nuts and seeds. Vitamin E protects eye cells from damage. Carrots and sweet potatoes. Beta-carotene for night vision. Bell peppers, high in vitamins A and C. I tell my patients, if your plate has lots of colors, dark greens, reds, oranges, purples, you're probably feeding your eyes well. Just like your skin, your eyes can be damaged by the sun's UV rays. Over time, UV exposure increases your risk for cataracts and AMD. Wear sunglasses that block 99 to 100% of both UVA and UVB rays whenever you're outside. Wraparound styles offer the best protection. Wear a wide-brimmed hat for extra protection. Remember, UV rays can damage your eyes even on cloudy days. Don't be fooled by price. Expensive doesn't always mean better UV protection. Check the label to ensure they block 99 to 100% of UV rays. In today's world, even seniors spend significant time looking at phones, tablets, computers, and TVs. This can lead to digital eye strain. Follow the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for at least 20 seconds. This simple habit relaxes your eye muscles and reduces fatigue, dryness, and blurred vision. Position your screen slightly below eye level, about 20 to 26 inches from your eyes. Reduce glare by positioning screens away from windows. Adjust brightness and contrast for comfort. Use artificial tears if your eyes feel dry. Blink more often. We blink less when staring at screens. Your eyes need moisture to function properly. Dehydration can lead to dry, irritated eyes. Aim for 6 to 8 glasses of water daily. If you have dry eyes, ask your doctor about artificial tears, which are lubricating eye drops. I've mentioned this before, but it bears repeating. Smoking doubles your risk of cataracts. It increases AMD risk by 2 to 3 times. It raises your risk of glaucoma. It damages the optic nerve, and it can cause dry eyes. If you smoke, quitting is the single best thing you can do for your eye health. Talk to your doctor about smoking cessation programs. Regular physical activity improves blood circulation, including to your eyes. It also helps control conditions like diabetes, high blood pressure, and high cholesterol that can damage your eyes. Aim for at least 30 minutes of moderate exercise most days of the week. Even walking counts. Your eyes need rest. During sleep, your eyes are continuously lubricated and irritants are cleared away. Aim for 7 to 8 hours of quality sleep. If you have trouble sleeping, talk to your doctor. Wash your hands before touching your eyes or putting in contact lenses. Remove eye makeup before bed. Replace eye makeup every 3 months to prevent bacterial buildup. Never share eye makeup. If you wear contacts, follow proper cleaning and replacement schedules. Diabetes, high blood pressure, and high cholesterol can all damage your eyes. Work with your doctor to keep these conditions well controlled. Many eye diseases run in families. If your parents or siblings have had glaucoma, AMD, or other eye conditions, tell your eye doctor. You may need more frequent screenings. Let me give you something practical. Here's a simple daily and weekly routine. Daily. Eat colorful, eye-healthy foods, drink plenty of water, take breaks from screens using the 20-20-20 rule, wear sunglasses when outdoors, get adequate sleep. Weekly. Eat fatty fish twice a week. Exercise most days. Yearly. Get a comprehensive eye exam. Review your family eye health history with your doctor. These habits aren't complicated, but they're powerful. Small, consistent actions create big results over time. Now let's address some final important questions. This is critical information that every senior needs to know. Let me be very clear about this. If you're 60 or older with no eye problems, get a comprehensive eye exam every 1 to 2 years. If you have risk factors like diabetes, family history of eye disease, or previous eye problems, get annual comprehensive eye exams, or more often as your doctor recommends. If you have an existing eye condition, follow your doctor's specific recommendations. This might be every 3 to 6 months. A comprehensive eye exam is not just a vision screening at the DMV or a quick check at the drugstore. A comprehensive dilated eye exam includes a visual acuity test, reading an eye chart, a refraction test, determining your exact eyeglass prescription, eye pressure measurement, screening for glaucoma, pupil dilation, drops that widen your pupils so the doctor can examine your retina, optic nerve, and blood vessels in detail, visual field test, checking your peripheral vision, and slit lamp examination, examining the front structures of your eye. The dilation is important. It's the only way to fully examine the back of your eye for diseases like AMD, diabetic retinopathy, and glaucoma damage. Some symptoms require immediate attention, same day, or even going to an emergency room. Never wait if you experience sudden vision loss in one or both eyes. Sudden onset of many floaters with flashes of light, a curtain or shadow moving across your vision, severe eye pain, eye injury or trauma, chemical splash in the eye, something stuck in your eye that you can't remove. See an eye doctor the same day for sudden blurred or double vision, sudden red painful eye, sudden light sensitivity, new onset of floaters or flashes, any sudden change in vision. Schedule an appointment soon for gradual vision changes. Persistent eye discomfort, frequent headaches with eye strain, difficulty reading or seeing at night, halos around lights, eye redness that doesn't improve in a few days, persistent dry eyes, watery eyes, new or worsening floaters that aren't sudden. I cannot stress this enough. With eye problems, time matters. Many serious eye conditions are treatable if caught early, but can cause permanent vision loss if delayed. I had a patient named George who woke up one morning with sudden vision loss in his right eye. He decided to wait a few hours to see if it got better. Those few hours made the difference between saving his vision and permanent loss. He had a retinal artery occlusion, essentially a stroke in his eye. If he'd come in immediately, we might have saved more of his vision. Your vision is never bothering anyone. Eye doctors would much rather see you for something that turns out to be minor than miss something serious. With eye emergencies, waiting can mean permanent vision loss. It's always better to be checked and reassured than to wait and lose your sight. Many communities have low-cost eye care programs for seniors. Medicare covers annual dilated eye exams for people with diabetes or at risk for glaucoma. Many optometry schools and teaching hospitals offer reduced-cost care. Ask about options. There's usually a way to get the care you need. I understand fear completely. But here's the truth. Most eye diseases are very treatable when caught early. Fear of finding something shouldn't prevent you from protecting your vision. Early detection almost always leads to better outcomes. Be an active participant in your eye care. Ask, what's my current eye health status? Am I at risk for any eye diseases based on my health history? How often should I be examined? Should I be taking any supplements for my eyes? Are there any changes I should watch for between now and my next visit? What lifestyle changes would benefit my eyes? Write down your questions before your appointment and take notes during it. Bring a list of your medications. Some can affect your eyes. Your eyes are precious. Don't gamble with your vision. When in doubt, get checked out. Now let's bring all of this together. We've covered a lot of ground today, haven't we? Let's recap the most important takeaways that could protect your vision for years to come. First, understand that most age-related eye problems develop slowly and silently. Cataracts, glaucoma, diabetic retinopathy, and macular degeneration often have no symptoms in their early stages. That's why regular comprehensive eye exams are non-negotiable. They're your early warning system. Second, many causes of vision loss in seniors are preventable or treatable if caught early. You have more control over your eye health than you might think. Third, small daily habits make a huge difference. Eat colorful, nutrient-rich foods, especially leafy greens and fatty fish. Wear UV protective sunglasses every time you go outside. Take breaks from screens using the 20-20-20 rule. Don't smoke, and work with your doctor to quit if you do. Control your blood sugar, blood pressure, and cholesterol. Stay physically active. Fourth, know the warning signs that require immediate attention: sudden vision changes, sudden floaters with flashes of light, a curtain or shadow in your vision, severe eye pain, eye injury. Don't wait. These are emergencies. Time is vision. Fifth, if you have diabetes, you must have annual dilated eye exams even if your vision seems perfect. Diabetic eye disease silently damages your eyes long before you notice symptoms. And finally, advocate for yourself. If something doesn't feel right with your eyes, trust your instincts and see a doctor. You know your body better than anyone else. I want you to understand something important. Losing your vision is not an inevitable part of aging. Yes, our eyes change as we get older, but with the right knowledge, regular checkups, and simple daily habits, you can protect your precious eyesight well into your 80s, 90s, and beyond. Think about everything you love to see: your grandchildren's faces, the books you enjoy reading, the beautiful world around you, your favorite TV shows, the faces of your friends. All of this is worth protecting. Here's what I want you to do after watching this video. Step 1. If you haven't had a comprehensive dilated eye exam in the past year, or 2 years if you're at low risk, call your eye doctor Monday morning and schedule one. Put this video on pause right now and add it to your calendar or to-do list. I'm serious. This one action could save your sight. Step 2. Look at your diet this week. Are you eating leafy greens and colorful vegetables? Are you including fatty fish? If not, add them to your grocery list. Step 3. If you notice any sudden changes in your vision, anything we discussed today, don't wait. Get it checked immediately. Step 4. Share this video with someone you love. Maybe your spouse, a friend, a sibling. Eye health information saves vision, but only if people know it. You could be protecting someone else's eyesight by sharing this. Remember, I'm Dr. Adam Carter, and here at Seniors Life Health, we're committed to giving you practical, easy-to-understand health information that empowers you to live your healthiest, most vibrant years. Your vision is one of your most precious gifts. Small steps today protect your sight for decades to come. You have the power to preserve your vision. Use it. If you found this video helpful, please subscribe to Seniors Life Health by clicking that button below. We publish new videos every week on topics that matter most to seniors, from managing diabetes and heart health to nutrition, exercise, and exactly the kind of practical medical information we covered today. And click the bell icon so YouTube notifies you whenever we post a new video. You don't want to miss information that could protect your health. Give this video a thumbs up if you learned something valuable. It helps other seniors discover this information too. And please, leave a comment below. Tell me which eye health question was most helpful for you. Do you have other eye health questions you'd like me to answer? What other senior health topics would you like me to cover? I read the comments and use your feedback to create videos that serve you better. Also, check out the videos I've linked in the description below. If you have diabetes, I have a comprehensive video on managing blood sugar that complements what we discussed about diabetic eye disease. If you're concerned about nutrition, I have videos on the best foods for seniors. Thank you so much for spending this time with me today. I'm Dr. Adam Carter, and I'll see you in the next video. Until then, take care of those precious eyes, stay healthy, and remember, you have the power to protect your vision. Use it wisely.